Thank you everybody for coming through today. I'm not sure your weather there, but the weather here is pretty chilly and nice. Okay, but tonight we are definitely going to dig in to CKD, and I'll allow Mr. Lee to explain from the beginning. So over to you, Mr. Lee.
Tonight we are going to talk about the second part of the CKD seminar, which is actually focusing on the CKD complication. Right. So let's recap. There are 5 stages of CKD, and the CKD stages are basically defined by the kidney filtration function. Right. So you can see from this chart here, right? If your EGFR basically is glomerular filtration rate, which is a function of your kidney filtration function itself, is above 90%, then basically you are considered as healthy. If your EGFR is below 90, basically between 60 and 90, most of the time, if you don't have any other kidney damage condition, like where you have a high albuminemia problem, then generally most of us who are having that reading of 60 to 90 EGFR is also still considered as healthy kidney function. But if you are having EGFR that's lower than 60, then basically in the CKD classification itself, you will consider as stage 2. Now, basically this is the way we try to classify the degree of your CKD disease, right? So the higher the stage itself, which means the lower your kidney function, the more serious is your condition, right? Now, it's important for us to understand on the onset here for this session is that as I go along, I will actually explain a lot of CKD condition irrespective due to their stages, right? And you need to remember that the stages itself represent the progressive degree of CKD degeneration itself, okay? And each condition itself, each stage of itself basically have a very different requirement in terms of our nutritional needs as well as supplementation needs. This is going to be the key part of the session today. Okay, let's look at CKD as the disease progresses itself, right? There are many CKD complications that can arise from that. At the early stage itself, basically the first complication CKD patient will have, very common, is actually having hypertension. So hypertension is actually one of the complications arises from a CKD progression. Then as the disease progresses to a later stage, then we will have complications like anemia, and followed by hyperphosphatemia, and of course, as you get more severe in the CKD condition itself, you will have, in fact, a condition like uremia and cirrhosis. So basically, the complication of CKD actually increases as CKD progresses itself, which means that you are having a stage 4 CKD, you are in a CKD of stage 4, you probably will have anemia, hypertension, bone diseases, as well as actually having uremia complication. So which means that a typical stage 4 CKD patient itself would have more than one complications. And we have to deal with all these complications simultaneously. Okay, let's look at the early stage of CKD complication. At the early stage itself, basically in CKD stage 2, you will find that most often complication is because you can see edema, which basically a fluid retention. You'll find that your legs itself basically will have some fluid retention and some swelling of legs itself. And also, of course, this fluid retention itself will also give rise to your hypertension or hyperpressure. So this is the most common early stage complication of CKD. As CKD goes to stage 3, right, itself, then you will find that apart from having hypertension, right, apart from having a fluid retention in your legs itself, most often the patient will also suffer from some form of anemia itself, right? So with anemia, basically you will run the risk of actually having cardiovascular events, as well as you might have a higher risk of actually heart failure. Okay, let's look at the first serious complication arises from the CKD, which is actually a very common CKD complication, is anemia. Anemia is a very common complication in chronic kidney disease. Now you can see from this chart itself, right? As your stages of the CKD progresses from stage 2, which is in here, the 60 to eGFR 60 to 74, right? The anemia percentage, which is the incident of anemia for both men and women itself, will start to increase very substantially once you are complicated, or when you are in CKD stage 3. Right? So in the case of anemia complication, you'll notice that the men actually will suffer higher percentage, have more prevalent and higher risk of suffering from anemia compared with women as the CKD disease progresses itself. Now, anemia as a complication is both a risk factor and a complication for CKD. What does it mean? It means that basically if you're having anemia, right, you increase the risk of suffering from CKD. Right? On the other hand, a CKD patient itself, as you get worse, your anemia condition will get worse. Right? So basically it's both a risk factor and a complication. Right? So you can see from this chart here, right, G5, which is stage 5, which is actually the end stage chronic CKD disease patient itself, will have incidence of anemia very, very high. In fact, close to 50% of the stage 5 CKD patient will suffer from some form of anemia already, right? So early stage of it itself, like if you are in the CKD stage 3, right, your incidence of mild anemia basically over the years is only slightly increased. But as your stages, as your CKD stages increases itself, your incidence of mild anemia actually goes up very significantly. Okay, now why anemia is a very important consideration in our CKD management is that because anemia in itself is a potent multiplier of mortality. Right, you can see from here, a chart here show you, right, using healthy person as a reference. If you are suffering from anemia, right, your risk of 2 years mortality is 1.9, basically 90%, 1.9 times, right? But if you are suffering CKD and you are suffering also at the same time anemia, right, your risk of 2 years mortality, right, is 3.37 times. Again, if you are suffering from a condition we call heart failure and having anemia and heart failure, the risk of 2 years mortality is 3.78. Therefore, having anemia, regardless of what diseases you are having, actually anemia acts as a multiplier of mortality. It is very important, right, and a very important for CKD patient particularly, because anemia is a risk factor, it's also a complication, and it also actually is a multiplier of mortality, which means that if you are suffering from CKD and you suffer at the same time anemia, then you die early, basically. You die early. Okay, now in dealing with anemia itself, right? So, what are the clinical manifestation of anemia? Generally, if you are anemic in conditions, you will find yourself feeling very fatigued. This is the first sign of anemia. So, short of blood, and then you have chest pain. Now, the risk of problem with chest pain is that it might lead to heart attack. Right? So, anemic condition can increase your risk of heart attack. Remember, so if you are suffering from anemia, your risk of heart attack increases. So, right? So, other than that, other symptoms is actually rapid or irregular heartbeat. Right? This is also very common for people who are anemic in conditions. And also, you will find that you suffer from dizziness, lightheadedness when you move. You have sleep problem. You also have loss of appetite. These are general symptoms related to people who suffer from anemia. Now, what are the food that is rich in or good for anemia? Right. So we actually for anemia, anti-anemic food itself, we should search for food that's rich in iron. In this case, you can see from here the iron-rich food are including beef, liver, and other meats on that. And also, of course, you can get it from dark green leafy vegetable and dry fruits as well. You also should go for food that rich in folate. Folate, which is actually vitamin B9. It's a folate itself, right? So basically, folate, you can get it from fruit juice, dark green leafy vegetable, and green peas, and so on, right? We also should eat food that is rich in B12, right? We also should eat food that is rich in vitamin C. So therefore, from a dietary standpoint, if you're suffering from anemia itself, it benefits you to actually focus on food that's rich in iron, folate, vitamin B12, and vitamin C. Okay, now for the supplementary side, on the supplement side itself, right? If you're suffering from anemia and actually if you see a doctor, right, there is a standard therapy that the doctor will prescribe for you. There is a very standard one. Basically, that the doctor, I saw, he will prescribe you a supplement with iron pills, right? Vitamin B12 supplements, as well as folic acid. So these are the common, what they call the triad of anemia triad supplementation. Very standard, and it's one of the actually standard therapy for anemia across the Western medicine portfolio. Okay, so there are other alternative supplement that is actually can replace this standard iron, B12, and folic acid supplementation. Now, for people who have poor tolerance to iron pills, iron salt itself, especially for a woman that is actually pregnant, in the pregnancy itself, then lactoferrin actually is a very safe and effective alternative to actually iron supplementation, right? In the TCM context itself, there are two herbs. One is Pentac ginseng, right? And one is the Angelaria sinensis, which in Chinese we call tan kui. So these two herbs are very commonly prescribed for people who are anemic condition or suffer from anemia. Okay, in TCM side itself, I must say, right, in dealing with anemic condition, I will say that the TCM tonics are generally much more effective than taking supplementation, Western supplementation, and is actually much more tolerable by most people. Right? So if you can, and if you are actually can able to have access to TCM formulation, right? I would recommend that you actually, for anemic condition, instead of just looking for the food or supplementation itself, actually take some TCM tonic will be actually as good as effective as a supplementation. Here there are three standard TCM hematopoiesis tonic, means tonic that is actually commonly prescribed for people who suffer from anemia itself, right? I put it here. I put the ingredients in both Chinese and English itself. Not so important. I think more important is that you should recognize that these are what they call standard tonics formulation that has been used over centuries in a TCM context itself. Among them, the Siwu soup. And for those who are in Atomy, I always use Siwu soup as a representation of hemohin, because among the ingredient of the Siwu soup itself, out of the 4 ingredients, actually hemohin actually taking up the formulation is very similar to Siwu soup, and actually the hemohin ingredient actually is the three ingredient of the Siwu soup itself. So in that context, they are very similar in pharmacological function as the Siwu soup for what they call for anti-anemia purposes itself. Then of course, there are 8 treasure soup as well as 10 complete nourishing soup. These 2 soups are also TCM formulation that's actually based on the Siwu soup as a basic formulation, and they add on top of it another 4 herbs for the 8 treasure soup, and in here they add another 2 more herbs for the 10 complete nourishing soup itself. But all in all these 3 TCM tonics are equally effective, and it's very what they call suitable for people who cannot also don't like to take pills as a supplementation, and they can actually take this as an alternative. Okay, now another complication that arises from CKD is actually the CKD associated cardiovascular disease. Now in this chart, you can see that CKD is a significant risk factor for cardiovascular events, right? So particularly the cardiovascular event in here we are referring to are events like heart attack and heart failure, example, and strokes. These are example of cardiovascular events. You can see from this chart itself, right? Also, I refer to the CKD stages. You can see, right? If your CKD stages is in stage 3, then your chances of actually having cardiovascular events here is about 11%. Compared to a stage 4 patient, your probability of suffering from cardiovascular events itself will increase to about 22%. And if you are in late stage of CKD, basically you can see that your risk of cardiovascular events increases to about 36%. So cardiovascular events is a very common complication arises for CKD patients. And CKD patients should guard against actually all these events. I will share with you what are the typical cardiovascular diseases that's affecting CKD patients. Okay, you can see from here, right? You can see that in this chart itself, also you can see that the EGFR here represent that this is stage 3 CKD. This is stage 3B CKD, and this is stage 4 CKD. And here show your hazard ratio, basically is a risk, the risk of each types of CKD diseases itself, CVD diseases. And you can see that among all the CVD diseases itself, the highest risk one is actually the peripheral artery diseases, which means that diseases that affects your limbs, your legs, your hands, fingers, and you resulting in a loss of flow of blood to your two limbs itself. So these actually are the first complication that arises for CKD patient. Then follow very closely behind is actually the heart failure. So the risk of heart failure for CKD patients are much higher than any other condition. So CKD patient, right, when you're having anemia, right, although that anemic patient have a risk of heart attack, but if you look at it itself from this chart, you can see that actually suffering from heart failure is more likely than having a heart attack, because heart attack, which actually in here in the green itself, is only lie on the third, as have a lower risk than compared with the heart failure. So CKD patient, in terms of CVD events, heart failure is one of the very high risk ratio events for CKD patient, which means that if you're suffering from CKD, right, as your CKD progresses itself, your risk of heart failure is actually much more higher than normal person. Right, in here, let's look at it from the heart failure context itself. CKD significantly increase the risk of heart failure. Now, here again, you can see, right, if you are in stage 1, your CKD in stage 1, basically your probability free of hospitalization for heart failure is actually only about 20%. 20% suffering risk is 20% after maybe about 4 years. After about 4 years. So in 4 years span itself, your risk of suffering from heart failure actually is about 20%. But if you are in the severe stage of CKD, which means like the late stage of stage 5 itself, right? In a 4 years time, your risk of actually suffering from heart failure actually is more than 70%. This one. So therefore, you can see the difference is that as your CKD progresses itself, your risk of heart failure increases significantly. Okay? So CKD with heart failure have low survivability, right? So this is another chart to show you, right? So this is a chart showing that over the span of 10 years itself, if you are suffering from CKD alone, right, then your survival probability over the 10 years is only about, maybe you hit about 60% after 10 years. Whereas if you are suffering from heart failure and CKD, these two together, right, your chances of survival actually after 10 years is less than 25%. So therefore, it is a very significant factor, right? So when you are suffering from CKD, right, with a heart failure kick in, then your chances of survival actually go down very, very fast. Okay, now for heart failure side, what are the therapeutic adjuvant that you can take, right? So here is the 4 well-studied herbs or compound that actually are beneficial for people who suffer from heart failure. The first one is asparagus, which is a TCM herbs itself, right? So this is a very common TCM herbs that is used for people who are suffering from heart diseases itself. The second one actually is a very common one that everybody is familiar with, is coenzyme Q10. Coenzyme Q10 actually is well known in Western supplementation, and in fact is already well studied and already established itself as an effective adjunctive therapy for heart failure. All right. Then another compound, which is hawthorn extract. Hawthorn extract itself, a lot of you might think that it's a TCM herb, but in reality itself, actually it is in the Europe side that they recognize the hawthorn extract as an oral treatment option for chronic heart failure. In fact, the European standard have recognized that the hawthorn extract can be used as a therapeutic supplement for people who suffer from heart failure itself, right? So then, of course, another TCM herb is ginseng, patent ginseng. So patent ginseng and asparagus are very common TCM herbs that's been prescribed for people who have heart condition. All right, let's look at the CoQ10. CoQ10 here, I want to take a bit of time because everybody actually are very familiar with what is CoQ10. So the study about CoQ10 support chronic heart failure, I will just skip, I'll leave it to you. There are enough study that support that. Then, as far as concerned, CoQ10 itself also improved the metabolic profile in CKD patients. Now, what is the implication of that itself? Basically, that a lot of CKD patients actually, as I mentioned in my previous session, is that actually have also diabetic condition. All right. So actually, this is one of the very common comorbidity for CKD patient as well. So therefore, taking CoQ10 also helps in the LDL profile cholesterol of the CKD patient. Right. Now, one very significant one we are talking about is actually CoQ10 combination with selenium. This study actually basically show that if you combine CoQ10 with selenium supplementation, in fact, you can improve the EGFR. Now, improving the kidney function is very rare, very rare. Most of the supplementation, most of the thing we are talking about itself, basically is slowing down or maintain the kidney function. But improving it itself are very unusual and very rare supplementation. So this combination of selenium and CoQ10 itself, and in this study, basically it showed that actually it does actually improve the EGFR, which means improve the kidney function. So this is a very significant study, although that this is not a meta-analysis, right? But as far as concerned, if you look at it itself, it is a human study that is well designed, and I think it's also a credible study. Okay, let's look at CKD progresses at the later stage. What are the complications at the later stage of CKD disease itself? You can see from here that beyond stage 2, when you reach CKD stage 3 to 5 itself, right? What are the common complications? You see, you will see that your fluid retention problem getting worse. So we have a severe edema itself. Then, of course, the hypertension getting uncontrolled. That means the hypertension itself, even you take medication, probably it still cannot be suppressed or normalized itself, right? And then because of your fluid retention problem, right, if your fluid is actually trapped in your lung, you will also have sign of shortness of breath there, right? And in the heart itself, you will have chest pain. So these are the late stage complication of CKD patient. Another complication actually that arises from later stage because your kidney function going down, right? Your blood itself will have increase in potassium level in your blood, right? So that means that the kidney is not able to do the function well, and therefore potassium build up in your blood itself. Now, high level of potassium in the blood itself will result in irregular heartbeat. This is a very high risk complication for heart attack. So irregular heartbeat itself will lead to cardiac arrest. So therefore, it is very important for us to manage a patient when you are in the later stage on making sure that the potassium in the blood is under control. Of course, increase in potassium level in the blood itself also resulting in low calcium in the blood. And everybody know calcium is essential building block for your bones itself. So this will result in bone diseases like osteoporosis. All right. So another problem relating to poor kidney function is that the kidney will not able to excrete your toxin from your body effectively, and resulting in the rising of your blood level of toxin in the blood. Right. So this is a condition we call uremia. So this uremia condition will resulting in a condition we call metabolic acidosis, which basically means that your body is getting too acidic, too much of toxin in there. And this can resulting in a lot of other complications we will discuss later. So bear in mind that at the later stage of CKD patient, as a progress, right, the late stage complications are much more complicated. They affect every part of our body, and therefore, in dealing with it itself, right, it becomes much more challenging. There's no single medicine can deal with all these things simultaneously. Okay, now nutrition actually is the only only therapeutic solution for CKD patient in the later stage. Now, because if you look at it, because of the vast what I call spectrum of complication that arises from the kidney function going down, right? So as far as concerned, the only viable frontline solution to deal with all these conditions actually is through your diet. So food is medicine in CKD. Yeah? So this is a very important statement. Please remember, right? Nutrition is a primary therapy in CKD management, not medicine. So therefore, as far as concerned, we must recognize that the standard healthy diet in CKD patient become risky. I'll explain why. As your stages changes, right, your nutritional needs changes. And therefore, CKD nutrition, since it's going to be used as a therapy for CKD management, the nutrition have to be very precise and specific for individual CKD condition. So it is a precise clinical therapy intervention. So which means that the food the CKD patient is going to take is going to be very, very controlled. It's like taking a medicine. Cannot overdose, cannot underdose. So this is actually the key point in CKD management. So not medicine, but food. Actually, food is the medicine in CKD, late stage CKD treatment. Right. So what are the objective of the food in treatment of CKD? First is that the food will help to slow the disease progression. Right. You will also help to prevent the toxic in the blood, or what you call prevent uremic complication. It means that too high toxic level in the blood. Right? You also help to avoid protein energy wasting because you are controlling your food intake, right? Precisely. The problem is that, in fact, a lot of CKD patients at the later stage, your kidney cannot be overloaded. But eating protein, especially the meat itself, will have a tendency to overload the kidney. And therefore, there is a lot of restriction in the amount of protein you can take for CKD patient. Now, but unfortunately, if you are restricting your protein intake, then your protein is actually the key source of supply for your energy, your body energy, right? And your muscle. Right. So striking a very important balance between the right amount of protein intake is very critical for CKD patient. If you don't take enough of protein, then you have muscle wasting and you have energy, no enough energy. And your body will also collapse. But on the other hand, if you are taking over excessive of protein, you will overburden your kidney and also resulting in your kidney deteriorating in your function. Okay, now, so here comes the actual most important part of actually the dietary treatment for CKD patient. Now, this chart is very important. This chart actually is a summary. And I want everyone here to understand from this chart itself. Let me explain. Now, if you are CKD stage 1 and stage 2, generally, you don't have much concern. In terms of that itself, I have mentioned already, in CKD patient, we are focusing on the protein intake because the protein actually affects the kidney workload. We are very focused on the sodium intake because sodium affects our hypertension, blood pressure, and actually also affects our water retention problem, right? So we are very focused on the potassium intake itself because that potassium actually, if you have high potassium, it can cause irregular heartbeat and resulting in cardiac arrest itself. We are also very focused on the amount of phosphorus intake itself because the phosphorus problem itself will resulting in your bone diseases and affecting your calcium in your blood. So therefore, in terms of the diet itself for CKD patient, the focus always is on protein the amount of protein you can take per day, the amount of your sodium, potassium, and phosphorus you can take per day, right? And what are the type of dietary model you should take, and what are dietary types of diet you should take, communicate. So let's look at this table itself. Now, just to let you know, if you are in early stage of CKD, like G1 and stage 1 and stage 2, which basically your EGFR is 60 and above, normally you don't have too much constraint in your food diet. You don't have to too worry, right? You talk about protein is 0.8 gram per kilogram of your weight per day. Itself basically is if you are 60 kg, you probably have to, can take 4.8 gram, 48 gram of meat a day without problem, protein without problem. Now, 48 gram is not just the meat, it's a protein amount. So therefore, actually the protein amount are higher. All right. So in this case, I'll take the example of sodium. So we're talking about limiting sodium. You are in stage 1 and stage 2 CKD. You don't really have much of a constraint. You just have to keep a reasonably low sodium diet of 2.3 gram per day. Now, this is equivalent to about 6 gram of salt. 6 gram of salt is quite a lot. 6 gram of salt is generally about 12 teaspoons of salt. Remember. So therefore, if you are keeping your overall daily diet below 12 teaspoons of salt, is good enough. Actually, this is very reasonable amount of restriction anyway. So at early stage of CKD, no constraint too much on your diet, no constraint on the protein intake itself. In fact, you can take even higher. It doesn't really have much problem, right? Your kidney still can handle. And generally, we recommend Mediterranean diet or plant-based diet, right? So high in fiber, fruits, vegetable, unless you are suffering from hyperkalemia. Right? Now, when your CKD start hitting stage 3, now this is where I want to caution everyone that if a CKD patient tell you that he's in a CKD stage 3 and beyond, right, then there is a requirement for you to make sure that his protein intake, his sodium, potassium, and phosphorus intake are closely monitored, right? So in this case, you can see from here, the sodium intake are still within very reasonable amount of less than 5 grams of salt per day, right? And you really have to just monitor your potassium and phosphorus to make sure that they are not exceeding the normal level, right? And generally, your diet is still actually just focused on limiting processed food, limiting high phosphorus dairy and nuts itself, right? So that's it. It's still not much of restriction and you're still okay. That means you still can eat freely, not much of a big problem. Now, if your CKD is stage 4, then there is a very high restriction on your diet, right? You have to be well supervised to make sure that you do not overtake your protein intake, right? And your sodium, phosphorus, and potassium are restricted. They are all restricted, right? So, and when you're in a diet, you basically can only take high quality lean protein like fish, egg whites, and poultry, right? And you cannot drink too much of water because of the severe water retention problem. And actually, in this case, your meal, you should actually have small frequent meal instead of big meal itself, not to overload your kidney itself. So just a caution, and that means a general guideline, right? CKD patient beyond stage 3, that means you are stage 4 and beyond, then generally is require very special dietary attention. You have to be very careful about the patient's intake, and therefore, from the supplementation standpoint, is also very restrictive. So you need to be aware. If you are in stage 1, stage 2, generally is like a normal person, not much of control, just a healthy diet will be good enough. Okay, now look at the diet. Because CKD patient very often doesn't have only CKD condition. Some CKD patient will have cardiovascular disease with them. Some of them will suffer diabetic condition as well. Some of them will have both cardiovascular disease condition as well as diabetic condition itself. So therefore, what are the types of diet I should take then? If I have CKD and I also have other comorbidities itself, right? Here is a general guideline, right? You can see from here that, as I mentioned, right, if you are in stage 1, basically, you don't have much problem. You can take the DASH diet. If you are on a cardiovascular disease, DASH diet actually is a diet that control your sodium intake, right? And if you are in stage 2, also you take DASH diet. Actually, if you are having cardiovascular disease as a comorbidities, basically DASH diet is focusing on low sodium, right? Now, diabetic, if you have a CKD plus diabetic, basically stage 1, you will concentrate on diabetic diet itself, which is carbo-glycemic index and so on. So in stage 2, again, you still stick to your diabetic index, diet, but together you need to add in a control on your sodium intake, right? So if you are having CVD as well as diabetic condition together as well, then the general recommended diet is actually meridian diet for both stage 1 and stage 2 patients. So this is well and good. I hope that everybody understand, right? Now, when you are in stage 3, then you look at this table itself, the diet change, which means that when you are in stage 3 of CKD, the diet must follow strictly to the CKD diet guideline that I mentioned earlier, right? So therefore, CKD stage 3 and stage 4 patients have a very distinctive different dietary requirement from CKD stage 1 and stage 2. This is the cutoff point. Remember that. Okay, now I want to talk about a few important and beneficial supplement for CKD patients. One of them is vitamin D. So I show you this chart here, right? Vitamin D in here, you can see that high amount of vitamin D actually will reduce your incidence of CKD progression, right? Over the years of 60 months, over the time of 60 months, if your body has sufficient vitamin D, in this case, the red line means the vitamin D in the blood level is high and normal, right? Your CKD progression, diabetic kidney disease progression itself, right? Actually, the progression are actually very slow, right? However, if you are vitamin D deficient, meaning you are lack of vitamin D in the blood level, you can see that over the 60 months time progression itself, your incidence of suffering from CKD itself goes up very, very rapidly. So vitamin D is a very important supplementation to slow down chronic kidney disease in people who are having type 2 diabetic itself. So this is an important supplementation for type 2 diabetic patients with chronic kidney disease. Okay, another supplement I'm going to talk about is actually the omega-3 fatty acid. Omega-3 fatty acid itself, by itself, is not a renal protective therapy supplement, which means that it does not protect your kidney. But it is actually a very effective adjunct for diabetic patients with CKD, especially for people who have high CVD risk, which means that CKD patients that have cardiovascular disease risk itself. So therefore, those who have CKD and having cardiovascular disease or have CKD with diabetic condition itself, basically omega-3 serve as a very beneficial supplementation as well. Okay, then come to the third supplementation, probiotic. What is the benefits of probiotic? In fact, probiotic is the most important supplementation for all CKD patients because probiotic help to reduce your blood toxin in your body, right? So by reducing your uremic toxin and inflammation and protein urea in a CKD patient, basically probiotic actually act as a very effective supplementation and adjunct to the treatment of CKD patient. So you can see from here, these are all the study, right? We'll leave to you to as a reference. But as I say, probiotic is among all three supplementation, one of the most effective and safe supplementation for all spectrum of CKD patient. Okay, let's give you the summary of it itself, right? Now here I summarize the CKD patient supplementation needs. This will actually serve as a very important and good guideline for everyone who want to recommend CKD patient, right? So I break down into the supplement like iron, which is actually dealing with anemia, which is a very common complication of CKD patient, right? Then we talk about omega-3 and probiotic, right? These two are the common supplementation that we just discussed. Vitamin D, again, we just discussed. And vitamin C. Vitamin C is part of the supplement that we talk about, which helps in your anemic condition itself, right? So basically, vitamin C will help your iron absorption, and basically it's part of the vitamin C also helps in actually your inflammation as well as your red blood cell generation, right? Then we have a B vitamin. Why B vitamin is remember B12 and B9 are actually the standard supplementation tried for anemic condition itself, right? Then we talk about vitamin A and vitamin E, which I want to discuss with all of you because it's important to recognize that both vitamin A and vitamin E are not recommended for any CKD patient. So this is the one that I put it in highlight in red is because that it doesn't mean that CKD patient, even the early stage, they can actually freely take vitamin A and E. This is very important for you to consider. So you look at it itself, generally the omega-3 and probiotic are generally safe and recommended for all stages of CKD patient, right? So these are the supplement that generally a CKD patient can take in a general. Now, iron supplementation itself or depends on whether the condition of the patient is suffering from anemia or not, right? So if he's suffering from anemia, then you give iron supplementation. Of course, in this case, for all those who are actually in autoimmune itself, then I will recommend that for those who are anemic condition in CKD, you can recommend to take hemohin, as I have mentioned in my earlier last session on hemohin talk itself. So hemohin can be a viable alternative to anemic condition. So vitamin D and C. Vitamin D generally you can take. Generally you can look at yourself all the stages you can take without problem, right? But vitamin C itself, right? Actually, it does actually benefits stage 3 and beyond. The amount is stated here, right? But stage 1 and 2 avoid excessive of vitamin C itself because it affects the kidney. Remember, all right? So here comes the important types of vitamin that you all should consider carefully when you recommend CKD patient, right? Vitamin B itself, right? Basically, the CKD patient only require B12 and B9 with specific amount, which targeted towards their anemic condition itself. It's not all types of vitamin they needed, right? So therefore, generally what we consider is that if you vitamin supplementation, we have called the specific RENA formula. RENA formula are targeted formula that's suitable, designed for CKD patient only, right? So it's not the general multi B complex, vitamin B complex. It's not the same. So remember that, all right? So another two vitamin that should be avoided for CKD patient is vitamin A and E. A and E are oil-soluble vitamin. So they will increase the burden of your excretion of your kidney, and therefore they should be avoided across all classes of CKD patients. So remember, this is a very important supplementation guideline, right? So do not recommend supplementation without looking at this table. All right. Okay, now supplementation safe practice for CKD patient. I just want to highlight again one more time. First, supplement needs change as CKD progresses. You notice, you see that, you all know already. Another one is that when you take supplement for CKD patients should actually have regular blood tests, because blood tests are only way that accurately monitor their supplement deficiency and blood toxicity, which means that you are constantly need to monitor whether that your blood level, the toxin is high or you're under control, and whether you are in any deficiency of any supplementation or deficiency in anemic condition. All right. So, however, if you are miss a dose of your supplement, right, do not double up. Just continue with your regular schedule. Don't worry about that. Supplementations are not something that is like treatment medication that's dead or alive. You miss it, you must double up your dosage. Remember that, right? Now, very important here for everyone, because especially for those who want to recommend supplement for CKD patient. I want to put this chart in there is because if you want to recommend, know what you are recommending. Never offer the over-the-counter multivitamin. Over-the-counter multivitamin is not designed for CKD patient. It's designed for general population that's healthy, right? And because why? Because they contain inappropriate amounts of vitamin A, E, and K. These are all oil-soluble vitamins that can burden your kidney, right? Another one is that do not exceed 100 milligram per day of vitamin C at any CKD stage itself, because vitamin C high dosage itself increase the kidney stone risk, which you do not want your kidney to get affected, with burden, having a problem. Of course, another one is actually all the oil-soluble vitamin, the A, E, and K supplement should be avoided in CKD stage 3 and 5, unless it's specifically prescribed. So in this case, I already mentioned A and E should be totally avoided. K are uncertain condition, but the K should be supplement under some specific guidance. People who know how much and why you should take vitamin K. All right. Okay. So here also is that we know that CKD is a condition that actually we are trying to use food as a medicine to treat it. In TCM itself, basically TCM also have a portfolio of herbs that is also commonly in use. So you will be beneficial also for CKD patient to actually use it as an adjuvant for their treatment. So I can give here 4 actually selected TCM herbs, right? That is commonly used for people who are suffering from kidney problem. And in here, I also have mentioned their dosage, right? The typical daily dosage, as well as they are commonly used as adjuvant in which stage of kidney diseases itself. You can take it as a reference, right? So if you want to take TCM herbs itself, also remember, do not blindly go and take. You should recognize that a lot of herbs might even overburden your kidney, right? These are the 4 herbs that has been have well studied and proven that is beneficial for kidney function. Okay, another thing in the food for CKD is that everybody, we talk about supplement, we talk about herbs, all that. The food itself doesn't mean that you can take everything. One of the things that should be avoided is star fruit, right? Star fruit is the one that actually the CKD patient should be avoided, because there is a lot of study that the star fruit can cause toxic effect to CKD patient itself. So I leave you to go and do your own research, but there is enough study here to show that star fruit is actually will induce what they call kidney toxic, it will intoxicate your kidney itself. Okay, Now, for CKD patient, we also need to recognize when what are the warning signs and when they need to seek urgent or emergency care. So here I just provide a guideline for everyone who are, if you are care giver, right, to the CKD patient, do look out for all these warning signs. One is sudden severe shortness of breath, chest pain, or feeling as you might faint. This is actually also a sign of actually cardiac arrest with itself. Another one is marked reduction in urine output or inability to pass urine. This is a very severe sign of kidney failure where you cannot pass urine, right? Confusion, extreme drowsiness, or inability to stay awake. This is a case of condition whereby you have too much toxin in your blood. You affect your brain. The toxin is affecting your brain, your function. Persistent vomiting, high fever, or severe back pain with CKD. So this is actually also a case of high toxin in your body, resulting in all these symptoms. And new visible blood in urine, of course, when you have blood in urine, is an emergency as well. So remember, if you detected any of these warning signs, do send the patient for emergency care immediately. Okay, now let's come to the Atomy product itself. We'll talk about two products. So obviously, the first product is actually the Atomy probiotic, and here you can see the table here. Probiotic powder form and probiotic capsule form, right? So powder form actually is generally recommended in the case for CKD patient, and because that you actually also have prebiotic and enzyme itself, you actually you can take more. That means that in the case of CKD patient, Atomy probiotic 10 plus is a more suitable supplementation than the SCI micron itself, and because you have other things that can help in digestion. But the CFU per sachet itself can be increased to up to even 3 sachets a day without problem for the CKD patient. They are very safe and to take itself. So I will do away with all this application, which I think a lot of you are probably very familiar. I will give you the PDF file that you can do reference if you want to on that itself. So I did not include the CKD patients as a application here, is that because generally these are the typical targeted application for Atomy, the powder form. But included in here is that the CKD patient also actually wise to take 1 to 3 sachets per day. All right. SCI, again, more targeted towards higher dosage because of those specific condition that is affecting the GI side itself. I will also skip this itself. Okay, now another product we are talking about is actually the omega-3, which is very common in Atomy. Atomy have two omega-3 products. One is Alaska E omega-3, probably is the first version of the omega-3. Then later on, I think the Atomy come up with another one, which is RTG omega-3, right? So these two itself, I put it side by side, and just to show you what's the difference. Basically, the Alaska omega-3 have a slightly bigger soft gel size, right, compared with RTG omega-3, right? Then if you look at amount per serving that is recommended for Alaska E omega-3, actually is 2 soft gel per serving, but RTG omega-3 is 3 soft gel. So basically, this itself will resulting in both getting equal amount of EPA and DHA, which is the active ingredient of the omega-3. So which is 700 milligram per serving itself. All right. So here is the part that is just showing you different amount of different soft gel, but in the end you take the same amount active ingredient. But there is a key distinction in here I want to highlight, is because that Alaska E omega-3, if you look at the ingredient list, it contains vitamin E. But RTG omega-3 does not contain omega-3. Now, this is not the only distinction between Alaska omega-3 and RTG, right? RTG also have better bioavailability, right, itself, right? Now, having said that, I think that all of you would probably notice that then if I put this in here, which omega-3 is suitable for CKD patient, which is not suitable. So as I mentioned, vitamin E and A are not allowed in CKD patient, and therefore do not recommend Alaska E omega-3 to CKD patient because it contains the vitamin E in there, right? So if you look at it itself, RTG omega-3 is the suitable form of omega-3 for CKD patient, right? Now here are the dosage. I will leave it to you all to reference. No problem. I think that everybody can see based on the clinical dosage that has been actually studied. Okay, now in taking omega-3, right? There is a area whereby that you need to be concerned. Remember that we are talking about that excessive intake will also cause bleeding. So therefore, that you can recommend the right amount, but don't overdose on it. Because higher than 5 grams per day of EPA and DHA itself will resulting in actually bleeding risk itself, right? Now also, it actually also increase the bleeding risk if you are taking concurrently with anticoagulant medicine. So be careful about that. So if you're taking that itself, you need to be careful that you not want to take a high dose of omega-3, right? Now, another one which is very typical, very important is that omega-3 is not one types of supplement that can fit all types of CVD condition. People who have arterial fibrillation, which actually means irregular heartbeat itself, should control and not overdose on the omega-3 intake because this will exacerbate the condition itself, make it worse. Now, so therefore, you need to be very careful, right? While omega-3 is a good supplementation for CKD patients, you need to actually consider all these conditions when you give the recommendation itself. Okay, this is the session. I'll pass the time back to Pauline.